In today's news, Thailand's National Health Security Office has revealed the typical treatment costs for COVID cases in Thailand. Meanwhile, a progress report on Thailand's own COVID vaccines, and after decades of delay, the Thai House of Representatives has unanimously passed a bill criminalizing forced disappearances. Details on these stories coming up in this program. Sawadee krap, you're watching Thailand News Today, bringing you the top headlines in Thailand and beyond. And in our first story, following the CCSA's decision yesterday to lower the insurance coverage required for overseas arrivals, the health minister agrees the new figure is enough to cover COVID treatment based on the latest findings. Anutin Chanvirakul says figures from the National Health Security Office indicate that treatment costs for severe COVID cases are usually around 300,000 baht per person, which is less than 10,000 US dollars. So, from March the 1st, mandatory coverage for overseas arrivals will be reduced from 50,000 US dollars to 20,000. At its meeting yesterday, the CCSA not only decided to cut the insurance requirements, but also ditched the Day 5 PCR tests from March the 1st. Currently, all overseas arrivals have to show a negative PCR test result that was taken 72 hours before departure, take another PCR test on arrival, and again on Day 5 of their stay. Both tests in Thailand require a mandatory booking at an SHA Plus hotel, where guests must wait in their room on both days until they receive a negative result. Yeah, and they wondered why arrival numbers were low. The second, Day 5 test has been widely seen as a significant deterrent for would-be tourists, with tourism operators demanding all PCR testing to be dropped. The government has partially conceded, and from March the 1st, the Day 5 test will be replaced with a self-administered ATK test. However, the requirements for a negative PCR test 72 hours before departure plus the PCR test on arrival still remain, as does the Thailand Pass process. Anutin says antigen testing is an effective screening mechanism and points out that the vast majority of infections in Thailand are cases of local transmission anyway. He has repeated his call for everyone to get vaccinated and avoid high-risk activities in order to beat the latest wave of the virus. Thailand is currently developing 4 different COVID-19 vaccines, which could be ready for public use next year. The CCSA was briefed on the progress of each vaccine at its meeting yesterday. Julalongkorn is an mRNA vaccine being developed by a team at Chulalongkorn University and has received over 2.7 billion baht in funding from the Thai government. Currently in phase 2 trials, immunity has been reported as 2.5 times higher when compared to natural immunity or to 2 doses of other vaccines. Researchers expect to begin phase 3 trials in August of 2023. Meanwhile, the inactivated vaccine HXP-GPO-VAC is being developed by the government pharmacy organization and has received over 434 million baht in government funds. Clearly, it hasn't spent that money towards thinking of a catchy name. The vaccine is currently undergoing phase 2 trials with 250 volunteers between the ages of 18 and 75 taking part. HXP-GPO-VAC has been found to be safe and provides a good level of immunity. Phase 3 trials are expected to get underway in the 3rd quarter of next year. The third vaccine is being developed from a protein subunit of tobacco leaves and has received nearly 1.5 billion baht in government funding. Baya SARS-CoV-2 Vax has completed phase 1 testing on 48 volunteers between the ages of 18 and 60. The trials have shown to be safe, but researchers at Chulalongkorn University say the level of immunity generated is not satisfactory. They are now working on a second version in an attempt to increase immunity levels. If Baya SARS-CoV-2 Vax does prove successful, it could be registered in quarter 3 or 4 of next year and would be the first plant-based vaccine in Asia. The fourth vaccine being developed in the kingdom is a DNA vaccine administered by a jet injector, not by Jet Gunther. This is a device that replaces a needle by using a narrow stream of fluid to penetrate the skin and administer the vaccine. The Govt vaccine has received 650 million baht in government funding and is still in phase 1 and 2 trials. If successful, it's expected to be registered next year and will be the first vaccine not administered via needle.
Join the conversation and have your voice heard. Discuss the issues, share information, and get information. Thaiger Talk is where you keep in touch with everything Thailand. Go to thethaiger.com/talk.
After being delayed for decades, Thailand's House of Representatives has unanimously passed a draft law that criminalizes torture and forced disappearances. The bill is now awaiting Senate approval, which could take place in May and could help parents and partners of missing Thai activists take legal action. Those convicted of political disappearances and torture cases involving death could be imprisoned between 15 and 30 years. The United Nations estimates that there have been 82 forced disappearances in Thailand since 1980, but experts say the real number could be higher than that. One notorious forced disappearance in Thailand is that of activist Wanchalerm Satsaksit in 2020. Wanchalerm was an LGBT rights and pro-democracy activist. Once he gained publicity for his activism against the 2014 coup, he was called to attend a meeting at a military camp. He then fled to Cambodia. In June of 2020, Wanchalerm was kidnapped on the street in broad daylight. His sister was on the phone with him at the time and told the BBC about her last conversation with him. In her statement, she said she heard a loud bang that sounded like Wanchalerm had been in a car accident, but then she heard him say, "I can't breathe, I can't breathe." Human rights activists say authorities are often involved in cases like Wanchalerm's, and the perpetrators are rarely brought to justice. A director at Amnesty International Thailand told reporters that this draft law offers a glimmer of hope to grieving families of such victims. A teenager staying in a community isolation center while recovering from COVID said she was sexually assaulted by a young man staying in the same room, adding that there were no authorities monitoring the patients. Many of Thailand's field hospitals and isolation centers have numerous beds made from cardboard boxes, all in one large room, such as a gymnasium. The 15-year-old says she was staying in a co-ed isolation room in the central province of Ang Thong when a new patient, an 18-year-old man, started making sexual comments. Reports say the man would follow her around the room and went to her bed, touching her. At one point, he followed her to the bathroom where the teen says he attempted to rape her. The teenager had been admitted to the isolation center with around 10 of her friends who had also tested positive, and they were reportedly able to stop the man from assaulting her. Reports in Thai media say there were no authorities in the room when the assaults took place. Patients could contact the authorities on the messaging application line, but apparently they would reply late. The teenager says she tried to contact authorities when she had a stomach ache, and she did not get a response until 2 days later. After getting out of treatment, the teenager and her family reported to the officers at the Ang Thong Provincial Police Station and the Damrong Tham Center under the Ministry of Interior. Terrible month for Thai beaches, as authorities are now investigating an oil tanker after waste was found floating near an island off the coast of Chon Buri's Sattahip district. Yesterday, the Royal Thai Navy's corvette reported a waste spill around 9 kilometers away from the island and said it spread across a large area of the Gulf of Thailand. The Navy deployed a helicopter to track the spill route and found that the waste was coming from an oil tanker named Smooth Sea, not so smooth by them. The tanker headed to another island called Ilau and later docked at Sichang Island. The Maritime Enforcement Command Center authorities are investigating to determine if the waste was leaked from the tanker. The center shared that the updates on the situation will be released soon. A Royal Thai Navy spokesperson says the tanker operators could be charged for violating the Thailand Sailing Act if authorities found evidence of spreading waste into the sea. Suspects could face jail time of up to 3 years and a fine of up to 60,000 baht. The tanker would also have to pay compensation for cleanup efforts and nature rehabilitation. And that's all for our report. Thailand News Today will be back tomorrow. Meanwhile, you're not up to date on the Thaiger.